And welcome to another sizzling episode of Health Talk on Healthy Living, reaching you from the nation's capital, Abuja. I am Olamide Al-Hassan. Now, the month of October annually has been set aside to raise awareness against the prevalence of breast cancer. In 2020, there were 2.3 million women diagnosed with breast cancer and 685,000 deaths globally. As of the end of 2020, there were 7.8 million women alive who were diagnosed with breast cancer in the past 5 years, making it the world's most prevalent cancer. Now, breast cancer occurs in every country of the world in women at any age after puberty, but with increasing rates in later life. Breast cancer is a significant global health concern affecting millions of individuals annually. It can affect both men and women, although it is more common in women. On Healthy Living today, we'll discuss breast cancer, understanding the risk, early detection, and supporting those affected. And to help us shed light on the topic before us is a cardiothoracic nurse, Mr. Jumbo Asogwa Emmanuel, and he joins us virtually from Abia State. You're welcome to the program, Mr. Jumbo.
Thank you so much.
Now let's pick the issue of breast cancer from the scratch. Let's talk about what it means. Can you shed light on what breast cancer is?
Okay, breast cancer is a malignant tumor that develop in the cell of the breast. It can affect both the male and female, and majorly it is seen in female who are above 50 years. Now, risk factors of this breast cancer can be seen majorly in gender, just like I said, then age, family history, genetic factors. Also, it can also be gotten through radiation. That's exposure through radiation.
Wow. So what are the common symptoms of breast cancer that one should be aware of? But before you answer that, you said exposure to radiation. What kind of radiation are we talking
Yes.
about here?
Okay. Majorly radiation from either through the CT machine, X-ray. Most people, you notice that they tell them do not live closer to MTN masks, all these masks that carries much radiation. The reason is because uh, they may be exposed to a very high radiation, which might affect their body system. And majorly, radiation causes different types of cancer. So not just only breast cancer, but other types of cancer.
All right. So what are the common symptoms that one may observe that puts one at risk of breast cancer?
Okay, some of the symptoms of breast cancer, these are the first signs you will notice a breast cancer is lump. That's the major thing. You will notice a lump, a kind of a kind of stone-like in your breast that is abnormal, which you have not been seeing it there for some time. Then after which you notice that that lump will begin to increase in size, and you start feeling pain, abnormal pain. So these are the first signs of breast cancer.
Okay.
Yes.
So what are the main causes of breast cancer?
Breast cancer are majorly caused by, just like I said, they are majorly caused by that radiation.
The radiation,
It
yeah?
can be seen in family. Yes, it can be seen in family history. Other factors is hormonal. It can be as a result of changing the female hormone or excessive female hormone. Also, age and gender.
You talked about hormone. What could cause excessive hormone in a woman?
There are a lot of factors that can cause change in female hormone. So some of these include a disease condition can cause change in female hormone. Some of these can also include stress. It can also be genetic. You understand? That's the things that can lead to change in female hormone, or not just female hormone, but hormone. You know that it can apply to both male and female. That's cancer. So these are the things. Also, stress can cause this. Change of environment can also cause this too.
Wow. Okay, because you said some of these things, how is breast cancer actually diagnosed?
Okay, majorly we diagnose breast cancer at the first stage. That's why I said that you will notice a lump. You understand? So at the first stage, it will be the individual who will notice this sign. That is why it is we always tell either the male or the females to do what we call breast examination. This is one of the factors you can use to diagnose breast cancer at the first stage. Then after this stage, we can also introduce them to what we call mammogram. This machine will help us dictate the extent of this growth and to ascertain if this is actually a cancer. So the first stage is that of breast examination. Second is use of a mammogram.
Okay, I'm with you.
So, so that's the major two aspects we use in diagnosing that of breast cancer.
You mentioned earlier, you said in the early stage. Does it mean that breast
Yes.
cancer diagnosis have stages? And if there are, what are the stages?
We have stages of breast cancer. We have the primary, the secondary, and that's the final stage. Also, it can also be diagnosed into two parts. We have the acute, you understand? We have the also the chronic state of breast cancer. When we talk about chronic, acute, this is the first stage, and at this stage, we are kind of managing breast cancer. At this stage, it can be cured. You understand? At this
Okay.
first stage, it can be cured, but when it gets to chronic, it gets difficult to be cured. So we are just like managing it.
Okay, so when it gets to the last stage, it means I can no longer be cured, it has to be managed.
Yes,
So
of
while you were
course.
talking earlier, you talked about genetic factors being associated with breast cancer. How does family history truly impact an individual's risk of developing breast cancer?
Sorry, can I get you again?
I said while you were speaking earlier, you talked about genetic factors affecting
Yes.
a victim. So how does family history impact individuals' risk of developing breast cancer?
Okay, well, we'll talk about family history. Um, Remember, I said it's genetic.
Yes.
You understand? That is why it is appropriate for you to verify either from your parents or from your grandparents if any of these traits of breast cancer are in your lineage. Now,
Okay.
if there is risk of this breast cancer, it is always advised that you should go for that's mammogram starting from the age of 50, because these are the age bracket where you can where this breast cancer will start manifesting. So from the age of 50, we'll advise either the male folks or the female folks to go for this mammogram so that your doctor can take the appropriate measures to make sure that this cancer does not come up in reality or does not move over to that of a chronic stage.
Oh, okay. Now, you still made mention of chronic stage and maybe the early stage. How early is early when it comes to, I mean, how early is early when it comes to detection?
Okay, uh, breast cancer, for this breast cancer, I would say that majorly we always advocate that once you are a female, mostly to females, once you are at the age of 15, 20 to 15, you should start doing your breast examination. Through this means you can dictate it early. That's the major thing. And once you are able to dictate it early, treatment will be easy and it will be easy to manage at this age. So from the age of 15 years upward or from puberty upward, you are being advised to carry out that breast examination.
Okay, so at that early age, constant breast examination. Like how many times a year do we need to do that?
Okay, it's not, we say that mostly we do tell them to do this maybe each time you are taking your bath. You understand?
Okay, it's
Each
something
time
that
you are
can be
taking
done
your
at
bath, at
home.
least try to. Yes, it can be done at home
Okay.
based on that individual. You
Okay,
understand?
just so
You
viewers
will
understand
always
that.
tell them to do, yeah, maybe a time when you want to take your bath or after taking your bath, mostly when you are in front of the mirror, you can palpate and we have how to palpate. We don't just do the maybe hold the breast and you understand. We have ways of doing this to make sure that you go around the breast and palpate everywhere to check if you can detect any lump.
Okay. All right, but another thing that has kept me in thoughts is something I heard from, words on the streets. So I want you to either affirm it or refute it. There's this story that if you've ever had lump, whether it is cancerous or benign, you are still at the risk of having breast cancer in the future. How true is this?
Sorry, if you ever have lump, sorry if
If
I
you ever
get
had
you. If
lump
you ever have,
and the lump was taken out, either it was benign or cancerous, even if it wasn't cancerous and it was benign, you are still at the risk of having breast cancer in the future. How true?
uh, I'll say it's true. You understand? I'll say it's true. So for this reason, if you ever had any trace of lump, either at the breast, at the left side of your breast, and it was removed, you understand? There's still a possibility for the person to have it at the left side. Maybe if you have it at the left side, there's still every possibility for it to appear at the right hand side. So this is more reason why we encourage checkup. You understand? For you to meet with your doctor and for you to take your medications and also continue with the breast examination. Remember, I said that early detection will also help you to treat it fast if there is any trace of it or if there is a manifestation of this cancerous cell. So there is every possibility for it to reappear
Reemerge.
again.
All right. So this 2023 October is another month to create awareness on the prevalence of breast cancer. Could you please share with us some of the latest advancements in breast cancer screening and the early detection methods?
Sorry?
I said this 2023 October is another month to create more awareness on the prevalence of breast cancer. So I want you to share with us, based on some of your experiences, on the latest advancements in breast cancer screening and some of the early detection methods beside the palpation you just told us about.
Okay, so that the healthcare system has gone vast in order to kick out the increasing rate of breast cancer in the society, including that of Nigeria. So this has made us to put more energy to introduce that of health talk in diverse areas. Also, we have gone vast to get some of these machines in different areas in Nigeria. That is a mammogram machine, which helps us to detect this cancerous cell in the breast. So apart from that of breast cancer. That's palpation of the breast in order to detect this. We have gone vast to tell people to abstain from any form of radiation. You notice that most people put their phone on the either on the breast, you understand, or at the pocket. So we have a kind of inform them that some of these things carries radiation, which you might not notice it, but it has a very high radiation in it. So we have informed people that putting your phone either on the chest region uh, has increasing has risk of having this breast cancer, because the ray can move into the body system. Also, we have also introduced, informed people that mostly the ladies, because they are those who are prone to having this breast cancer, much of personal hygiene is needed. So, in times of the bra, which they are inner wear, they should make sure that they wash it very well, and not just most people do wash and wear. We don't encourage that. You understand? Make sure that you sun dry it very well, because most times you notice that your the breast, you understand, is open, and there's every risk of bacteria or any fungi moving in from your inner wear into the breast. You understand? So we encourage more of personal hygiene. So these are the means whereby we can curtail or remove any that's the increasing risk of breast cancer. So we have also introduced that's for the rural area where there is no more of medical things there. You
Okay.
understand? We have
Yes.
trained nurses, doctors who are there to inform that's uh, those who are aged, also those who cannot afford that's education. We also teach
Mm-hmm.
them on some of these things, to telling them that there is something called breast cancer, you understand, and also
Mm-hmm.
teach them they can uh, how they can get rid of this, and also that of the breast examination. And we also encourage that of checkup. So these are some of the things that the healthcare system have put in play in order to reduce the risk of breast cancer.
All right. Earlier on, it's quite a feat you've been doing so far, at least educating people on some of the risk and what to do to stay away from some of this risk. Now, let's look at what you said earlier. You had mentioned that from age 50 is prone to coming down with breast cancer. I think, are there exceptions to that age? Are there situations where some persons can have it earlier than 50? Because I think I saw a lady online that was sharing her story. She looked way younger than 50 anyway, and she had to do a surgery and cut out her, was it left or right? One of her breasts was out. She had a surgery, and that was, in her words, that was the best way to save her life. What, are there exceptions to that?
I would say that it's not only from the age of 50, you understand, but we see that those from 50 are at higher risk of having this breast cancer. That does not mean that those from puberty age upward cannot get the breast cancer. You understand? They can
Okay.
also get it, but those at higher risk are from 50 years upward. They are those that can get, that can easily get this. You understand? So those from puberty age, they are also at risk of this breast cancer.
All right, so early detection of breast cancer is usually highly emphasized. You also emphasize it. You've been emphasizing it since this conversation started. But how does this early diagnosis influence the prognosis and treatment options for breast cancer patients?
Just like I said, that early detection, you understand, this is a cancerous cell, and this cancerous cell, it can move into malignant. And what I mean by malignant, at this stage, the cells, that's the abnormal cell, tend to increase more very fast at this stage. Now, early detection helps you to detect these cells and treat them very fast, because for you treating this abnormal cell very fast, it helps you to stay more safe and healthy. You understand?
Of
Now,
course.
note that cancerous cell, it does not only affect that of the breast. You understand? Once it gets to malignant, it can also affect other systems, and also it can lead to lung cancer and other types of cancer. So early detection helps you to get rid of these cells and to stay more healthy.
Oh, I see. Okay, now, can you now explain the different treatment options available for breast cancer and how they are chosen for individual cases? And are there different treatment options?
Okay, of course, we have different treatment options. You understand? So the first stage we have surgery. That is removal of the lump. You understand?
Yes.
We either do mastectomy. That is removal of the entire breast. You
Okay,
understand?
I do.
Then when we talk about lupectomy, that's only removal of the lump. We remove only the lump. This is based on the case. Then at the first stage, we always do this, that's the surgery, either mastectomy or that of the lupectomy. Then the other treatment include radiation therapy. We have also chemo therapy. We have hormone therapy. So these are the major ones that we have in order to get rid of this breast cancer.
So, can you shed light on what these treatment options look like? Because the words are not very familiar and not all of us are medically inclined like you are.
Okay, just like I said, that's the surgery aspect involves taking the person, the individual, into the theater. Now, a surgery is being done either to remove the lump, only the site where the lump appears. You understand? This is done at the first stage. Then at the second stage, here involves removing the total breast, either the left part of the breast or the right side breast, where this cancer cell is being noticed. Now, for the second treatment, which is radiation therapy, now radiation is being used. You understand? So radiation is being used in order to get rid of this abnormal cell in the body. So we make use of high radiation in order to remove this. We also have chemotherapy. It's a form of medication which is used in order to kill or slow down the growth of this abnormal cell or cancerous cell. Then for the hormone therapy, we make use of a hormone receptor in order to, it's also a form of drug in which we take in order to block the particular hormone that is causing the excessive increase of that lump. You understand? So we take this medication in order to reduce either the growth of it, you understand, or to kill it. So these are the major
Now,
ones.
now you have come down to our level. All right, let's go on a quick break. When we return, the conversation continues. Stay with us, viewers. Welcome back, viewers. We're still discussing breast cancer with a cardiothoracic nurse, Jumbo Emmanuel. All right, Mr. Jumbo, before we went on the break, you were telling us about some of the treatment options and you brought it to the layman's language. But what is surprising me is how do this treatment regimen impact the quality of life and overall well-being of the breast cancer patients?
Okay, I would say that this treatment regimen, the idea there is to get rid of this cancerous cell and to make the individual healthy. So for any of the treatment strategy, it is majorly to get rid of the cells. So the doctor will examine the person through the machine, mammogram machine, and check if there is need to make use of surgery aspect or chemotherapy or radiation. This is based from the doctor this is side to decide which of these aspects will work well for the individual. So, and it's also based on, let's say, the degree of this cancerous cell. So, at the first stage, just like I mentioned, that when there is still a presence of lump, a tiny lump, the doctor can decide to go for lumpectomy. That's just removing only the lump. That's the parts that is being affected. You get, but when it affects the whole breast, that means the doctor can majorly decide to remove the whole breast. So all these majorly involve in order to get this person healthy again and to avoid this cancerous cell to spreading from the breast to the other aspect of this individual's body.
Oh, wow. Now, with all of these process now, I'm also thinking that they have to go through some challenges, both physically and emotionally. So from your experience, what are the challenges they actually tend to go through? I mean, the survivors now, during and after treatment.
Okay, there are a lot of challenges one can go through at this stage or before the treatment, during the treatment, and after the treatment. There are a lot of things that this individual can pass through. At the first stage is anxiety. This individual tends to be the individual begins to have this fear in him or her. The individual begins to have fear. Most people are afraid of the surgery. They'll be like, will I come out from this surgery? This is my first time going in for good surgery. Most other people will be like, see, I'm a lady and I need this one of my sexual organ. Removing one or removing both will surely will not make sense. You understand? They feel that maybe no guy will come up to them. You understand? So, psychologically, they are being affected, or physically, they are also being affected. So, it's left for the health personnel to encourage this person and tell the person that all hope is not yet lost. You understand? So, it is also ideal for the health worker also to introduce or to show this person somebody who has also passed through this stage of life. That person will help to encourage this person the more. You understand? So majorly they have anxiety, they are being affected of physically and emotionally, both psychologically.
I can imagine how tough that must be. And are there also patients who tend to live in denial? Because most times, I know we're a religious society, so oftentimes people tend to say, no, I don't have it. And they want to pray against it rather than get treated. How do you cope and how do you handle such patients?
Whoa, I would say that this is a very it's a very tough case, you understand? So those who are maybe affected by religious belief or their own personal belief. So we'll keep on doing our best to give the person the reason why he or she should go for either of the treatment, any of the treatment, either surgery, either chemotherapy, or either radiation therapy. We encourage this person to go in for any of them. You understand? Because cancer is not a thing that one can joke with. You understand? It kills, and mostly when it gets to the malignant stage, it kills. So we'll do our best to encourage them. We cannot force one into affecting anyone, but we'll do our best to encourage this individual to go in for any of them.
All right. So, are there any lifestyle changes or preventive measures that can help reduce the risk of breast cancer?
Okay, there are a lot of preventive measures. One of them includes staying away from any form of radiation. Two is dictating this cancerous cell early. Two, staying out of uh, tobacco, smoking. You understand? Alcohol. Some of these things can also cause it. You understand? Then we'll also encourage that of radiation, staying out of any form of radiation. You understand? So these are some of the things that will help us dictate or reduce the risk of this cancer, breast cancer.
Earlier, you talked about the treatment options you talked about. You mentioned surgery, and you also kind of talked about how some patients need to undergo surgery. Now, what happens in cases where some persons who need surgery refuse to take surgery? How do you then handle it? Because not everybody can cope with the fact that I had two breasts and I'm going to start living with one or going to start living with no breast at all.
Okay, just like I said, we have different methods. Some involve medications, you understand? Some involve medications, while some involve surgery aspect. Whereby this individual decide not to go for the surgery aspect, he can as well go for chemotherapy. He can as well decide to go for radiation therapy. You understand? So these are other method that does not involve the surgery aspect.
Okay, but these methods now, how effective are they when it comes to saving lives? The reason why I ask this question is that earlier this month, somebody made a post that I saw on one of my social media platforms, and he was expressing how his own sibling had died of breast cancer. He said she refused to take off her breast completely. So she chose to take other options. But taking off her breast could have saved her life. but she turned that down and instead thought to, keep managing it, which ended up taking her life. So what is the assurance rates, when it comes to, oh, if you do this, there's a 100% assurance that you're going to stay alive, but this one is a 50-50 option. When do you decide what treatment fits what person, and what is the rate of assurance of life?
Okay. For that of the let me just classify the breast cancer into 5 stages. You understand? Stage one, stage two, stage three to stage five. You
Okay.
understand? At the first stage, we will encourage them to go for, that is lumpectomy. That is the removal of the lump. You understand? At this first stage, we will not the doctor or the surgeon cannot go further to remove the whole breast, which is mastectomy. He cannot decide to remove the whole breast unless it is spreading already. You understand? So at this first stage, it is being we encourage the person, or we tell the person that, see, we are not removing the whole part of your breast, but we are only removing the lump. That means you still have your breast. You understand? Now, at the second stage, we can also decide maybe where the breast cancer have spread, or where the abnormal cells have spread all through the breast. We can decide to make use of chemotherapy. These are the drugs that helps either to reduce the rate at which these cells grow, or to kill it. You understand? So to kill this cell. Then the final stage where we can make use of, that's a mastectomy, removing the whole breast. And one thing is that after this surgery, or while still taking your medication, you are still giving after the surgery, you are still giving medications, and you are also being examined. That's for checkup, to make sure that these cells are not regenerating, they are not yet coming back to life again. So if in case they are, we also place them on medications that will help to reduce the rates. So for any of these, we'll give it 80%, 80% that you are going to be healthy. So far as you follow the instructions given to you, so 80% chance that you will be fine.
Okay. All right. So there's this other one that sounds really funny that people always say. I'm sure you must have heard it at some point because it became almost rampant in schools, and boys will always use it to laugh and all. They would say, first, we've heard that lactating mothers are safe from breast cancer. I want to know if that is true or not. And the second is that if the female breast is often massaged, she may be safe from the risk of breast cancer. How true is this?
Quite funny. For this, I was saying, those who are breastfeeding, let's start with that. Those who are breastfeeding, their chances of getting breast cancer is very low. You
Okay.
understand? Those who are breastfeeding, their chances to get breast cancers are very low. For those who are not breastfeeding, they have a kind of higher chances of getting this breast cancer. You understand? So we encourage. I saw a news where the same thing you just said. Those who palpate their breast, you understand, are not. There's a kind of reduction in rate of this breast cancer, but it is not yet proven. I've not seen where it is being proven, so we are yet to see that. So after some research, we'll verify if actually it is true. So we need to carry out some research on this area to make sure that this is actually true.
Oh, okay. So one more thing. I also detected that most young ladies around 25 or below tend to have breast lump most of the time. And I think I had a friend that had breast lump very early, I think around 23, 24, 25, and she had it taken out. And the next thing the doctor said was, try to get married early so you can have kids and start breastfeeding them. So I'm trying to understand the relationship between taking out that lump and getting married early to have kids to start breastfeeding. They said to avoid the
Okay,
lump coming back.
okay, yeah, I would say yes. You understand? Just like I told you earlier on that those who breastfeed, you understand, have they have a kind of lower rate of getting this breast cancer because excessive fluids that's the breast milk is going out, any discharge is going out through the breast. You understand? So they are lower risk of having this breast cancer. So that's why the doctor is kind of encouraging this lady, at least let it be that you must have given birth. You understand? You must have given birth. And notice that once a lady have developed this breast cancer before giving birth, you understand? This person is not going to breastfeed. Maybe this person is not going to breastfeed his or her baby. You understand what I'm trying to. So during the period of pregnancy or birth of the baby, if there is presence of this breast cancer, this individual is not advised to breastfeed the baby. But whereby this individual have already given birth and there is presence of this breast cancer, it is a kind of safer for the person because you already done maybe giving birth to your kids. So that is why the doctor was to trying to encourage this lady to try to at least get married, make sure you are giving birth before maybe if there is any other risk of this lump appearing later in life again. So that I think that was the reason why the doctor was encouraging the lady to uh, get married early.
Okay. We've talked about breast cancer in women and some of the situation, but what about men? Why would a man have breast cancer? And what puts a man at the risk of breast cancer? Do they have hormones in their system that can lead to it? I'm wondering.
Yes, yes. Just like I said that hormones, either excessive increase of the male hormone or reduction in male hormone or other hormones actually, you understand, can lead to this. You notice that most men take alcohol, that's tobacco, they do smoke. Some of these gives higher risk of developing this breast cancer. You notice that also most men are those that men mostly have pockets at the chest region. So mostly they are those that normally put their phone at the breast region. So they are also at risk of this, but they have a lower chance of getting it comparing them to the females. So they have lower risk. I will say out of 100 ladies, I will say that for me, 3% of men can develop breast cancer. So you can see the gap. You can see they have lower risk of having this breast cancer.
All right. So what
But that does
measures?
not
Okay, please
that
go
does not
ahead.
mean that does not mean that they don't have it, but they are lower risk.
Oh, lucky them. Lucky you, rather. So what measures can individuals take, either male or female, to reduce the risk of developing breast cancer either now or in the future?
Okay, we have several measures. At first, we will encourage any individual to trace back to your history to be sure that there is no sign of not just breast cancer but cancer in your lineage. You understand? So if there is any trace of this cancer, it is always I will always encourage them to at least speak with your doctor or your health personnel, telling them, see, my grandparents they have this. I don't know the possibility of me having this. You understand? Also, the breast examination is very important in this case. It is very easy. It is very easy, and also it is one of the first thing one who always tell one to do in any sort of breast cancer. Then for the male, both the male and female will encourage either reduction of tobacco smoking or avoiding it totally. So these are the things that can lead one into having this breast cancer. Also, getting away from any form of radiation, any form of radiation. So these are the things we'll tell one to do in this case.
All right. Now, how often should one perform the breast self-examination you were talking about that time? And when should one start getting mammograms as well?
Okay, for the breast cancer, just like I said before, uh, you can do it every day. You can do it every day. So far as that you are taking your bath every day. We do take our baths every day. So during that process of taking your bath, you can as well palpate the breast. You palpate up, you palpate down, palpate center. You go around, you massage in a circular motion. You raise your one hand up, you massage round to make sure that there's no lump by the side too. Towards the armpit side, you massage all these areas to make sure that there is no trace of any lump. Then for the mammogram, we we encourage those who have not given birth at all not to do the mammogram. You understand? We encourage those who have not given birth, those from 40 years below, not to do the mammogram. We encourage those above the 40 years to do the mammogram. Reason is because this mammogram is also a machine that carries ray. Also, it
Radiation,
carries
okay.
radiation also. So you taking it at that early age might also expose you to having this breast cancer. You
Okay.
understand? So we make sure that those that taking it has surpassed the age of giving birth, and it will be of much value for them than those below 40 years because it will also pose as a risk for those under 40 years.
Oh, okay. You talked about genetics earlier while we're discussing some of the risk factors, and you said genetics is part of it. So, considering that as a factor for having breast cancer, should we begin to consider having genetic testing?
Yes, actually there are some tests. You understand? There are some tests that we do in order to dictate the trace of cancer. They are blood tests. You understand that we do, but it's not majorly in Nigeria here. I don't know if it's been known. There are some tests, genetic tests that we do in order to detect if there is any trace of cancer in the bloodstream. So some of these tests are we do it, but mostly we base more of history taking. Understand to dictate of this genetic appearance of cancer cells, whereby we encourage those people who their parents, their grandparents has this cancer to at least speak up so that the health personnel or the doctor can give you measures in which you can take in order to make sure that these cells does not turn into malignant or to get rid of the cells.
Okay. But in as much as you talked about some persons who have family history, I don't know cases where randomly somebody just has it in a family and they are the first point of contact.
Of course, there
Oh,
are cases. You understand? There are cases whereby this individual is the first person having it in the family. Just like I mentioned, there are different ways one can get this breast cancer. It is not only it is not only in genetic aspect. You can get it from age factor. Majorly, I say those above 40, 50 years are prone to this. Majorly, I also say that those who are chronic, uh, who majorly take more of tobacco to smoking can also get this.
true.
Majorly, I also say those who are exposed to radiation, all sorts of radiations, can also get this. So these are those maybe who see that I have are the first contact of having this breast cancer.
All right. Thank you very much. But in rounding up now, what would be your advice to people who are currently battling breast cancer and those who need to be aware, caregivers, the society at large?
My advice for those who are battling with breast cancer is that I understand that it is not easy to fight cancer. And I will encourage every one of you out there who are battling with cancer to keep on fighting. I believe it's not going to kill you. We are coming up very strong, and I will encourage you to have faith that it will heal, and also stick to the medical stick with the medications that your doctor has given to you, and also stick with the constant physical examination. For those healthcare who are out there, I also encourage every one of them to speak up, because most people out there does not really know more of this breast cancer. So I would encourage them to engage more in health talks and to speak to the rural areas, so that they can know that there's something called breast cancer.
All right. Thank you very much, cardiothoracic nurse Jumbo Asogwa Emmanuel, for joining us on Healthy Living today. We appreciate you for sharing your wealth of knowledge with us. Thank you.
You're welcome. Thank you so much for the time.
Thank you too. All right, viewers, that's where we'll draw the curtains on today's show. I hope you've learned a thing or two. And I hope you also remember that breast cancer is not a death sentence. You can always do your self-examination and do well to stay safe. I am Olamide Al Hassan. I'll see you again next week. Bye.